My name is Dr. Daniel Kyabayinze. I am a research officer with COMDIS Uganda office. I have been doing this for the last 4 years, doing different pieces of work with the research group with the Ministry of Health in partnership with Malaria Consortium. The Malaria Consortium did an evaluation in the accuracy and usefulness of rapid diagnostic tests in Uganda. However, we had started by bringing stakeholders to debate the agenda for diagnostics in Uganda. That was followed by a workshop, a concept note, and later a research project with which we partnered with the Ministry of Health, and we worked in one of the rural health centers to evaluate the accuracy and the usefulness of the RDTs. Later, we also tried to verify how long these tests remain positive and valid after one has been effectively treated. All this fed into a whole process into communicating and developing a policy. Our involvement then led to the ministry to invite us to be part of their committee in implementing and documenting the process of introducing parasite-based diagnosis, where the government will stop treating every fever as malaria, but will recommend that everybody is tested prior to being given at malarials. The rapid diagnostic tests are simple kind of paper-like strips which are handheld without any technology. It is easy for one health worker to be trained to use it as long as they can learn how to take off a finger prick blood and place a drop of blood on one end of the paper, then drop another piece of reagent on that extreme end so that the blood and the mixture of that reagent mixes on that pieces of paper. Then it ends up giving you 2 straight lines. If there are 2, then you can easily interpret as being a positive for malaria, and when it's only 1 line, which is a control line, it tells you that there's no malaria parasites which have been circulating in that person's blood. So when you combine what you see on paper and also what the patient is reporting, then you can tell that the symptoms or reports or complaints being given are related to what you're seeing on the test. The favorite part has been when the results were finally presented to the ministry, and the ministry discovered that there is a role to use the research work in implementing their rollout, and we are invited as the research team to be part of the team going to implement in the country. So we found that our working with the ministry had a multiplier effect. We are part of their resource team now, coming from a research background.